As a physical therapist, what can you tell us about how physical therapy can treat incontinence?
Well, I specialize in what's known as pelvic floor dysfunction. So I'd like to share with you what the pelvic floor actually looks like. It's a hidden muscle that is positioned underneath all of your organs. And this is what it looks like. Okay. This is a muscle that does not give you any motion. So it has three very different functions, different from regular muscles. And the first one is just that. It supports all of your organs. Secondly, it acts as a faucet. These are the muscles you use. You relax these muscles when you want to have a bowel movement or if you want to urinate. And if these muscles are strong enough, they should prevent leakage from these openings as well. Thirdly, the pelvic floor plays a role in sexual appreciation. And this is the muscle that gets stretched to the max when you give birth. Now, if a woman has stress urinary incontinence, let's say she leaks urine when she dances, if we're able to make this muscle strong enough, she will be pad-free even while dancing in, let's say, 8 to 16 visits. Now, the pelvic floor is not that easy to find because it's hidden. So in physical therapy, we use something that's called surface EMG biofeedback. And this is what it looks like. These are simple stick-on electrodes. And think of it as a EKG. It works the exact same way. You are not going to really feel anything, no shock treatments whatsoever, and no needles. And let me show you Kim's before and after graphs, and you'll see why she's now able to run without having any trouble. So this was Kim's surface EMG graph when she first came into the clinic. And you can see how much she improved, which is very motivational for her. And this allowed her to do those 5K runs without having any trouble. Towards the latter part of the program, we then employ Pilates, which serves to put even more resistance on the pelvic floor muscle. Now, if someone has urge urinary incontinence, we have to take a totally different approach. I'm able to actually make the urge to urinate disappear, poof, without using the bathroom. And this is very powerful because it allows women to leave their house, and men too, without mapping out where every bathroom is ahead of time. It allows them to travel to places where they don't even know where the bathrooms are. So to say that physical therapy changes people's lives is really no exaggeration. Now, if someone has nocturia, I can get them sleeping through the entire night without getting up multiple times to use the bathroom. So they wake up refreshed, energetic, not needing that afternoon nap, and even their memory is better. 65%, it's an estimate, of women suffer from a condition we call pelvic organ prolapse. This is where one or more of the organs in the pelvis drop down, giving the woman a very uncomfortable falling out feeling. And if we improve the endurance of the pelvic floor muscle, we're able to even ward off surgery. And let's face it, it's a basic tenet of medicine that proven non-invasive techniques should always be tried first before surgery.
And that's 65% or
65%,
oh,
yes,
okay.
Which is huge, really.
Yeah.
Have some degree of pelvic organ prolapse. There are 4 stages, and physical therapy has been shown to improve the prolapse by a full stage.